Good afternoon, everyone, and thank you again for joining today. My name is Dante D. Buxton, and I serve as the Diversity, Equity, and Inclusion Marketing and Strategic Mapping Consultant for the National Maternal Mental Health Hotline. We are indeed delighted that you have joined us today for our informational webinar. Before we begin, please allow us a moment to share some general housekeeping rules for today's event. First, we're using the accessibility features. With this, you have the option to use closed captioning. By selecting CC, closed captioning, or live transcript, it gives you the option to have an ongoing running transcript. Please adjust to your own comfortability. Additionally, please use the question and answer function to submit questions. The goal of this is to allow participants to ask questions that strengthen our ability to provide insights. We encourage upvoting for top list placement. Also, review the chat for resource links to offer up comments or experiences. This webinar will also be recorded. The National Maternal Mental Health Hotline is funded through a contract, the U.S. Department of Health and Human Services, Health Resources and Services Administration. Today's webinar will cover the following topics: introduction and welcome, overview of the National Maternal Mental Health Hotline, the National Maternal Mental Health Services and Resources, the call to action, how you can get involved, and the wrap up. At this time, I am pleased to introduce our presenters for today's webinar. First, I'd like to introduce Dr. Michael Warren, who is the Associate Administrator of the Maternal and Child Health Bureau in the Health Resource and Service Administration. I'm equally pleased to introduce Ms. Tiffany J. Williams, who serves as the National Project Director for the National Maternal Mental Health Hotline. At this time, to take us further, I'll pass it along to Dr. Michael Warren. Thank you again for joining.
Thank you so much, Dante. Good afternoon or good morning to folks who are joining us. I know we've got folks from all over the country. As Dante mentioned, I'm Dr. Michael Warren. I'm the Associate Administrator of the Maternal and Child Health Bureau here at the Health Resources and Services Administration, or HRSA. It's so exciting to be able to spend a little bit of time with you all today to talk about our Bureau's investments in supporting maternal health, and in particular, maternal mental health. And even more specifically, what we're doing through the National Maternal Mental Health Hotline. For folks who are on who may just be hearing about the hotline for the first time, it provides free, confidential, 24/7 emotional support, resources, and referral to pregnant and postpartum individuals who are facing mental health challenges, as well as their loved ones. And this past weekend, or 2 weekends ago, this past Mother's Day, we celebrated the 1-year anniversary of the hotline. So I'm really excited to be able to share some key metrics for how that year has gone, and what you and your patients or clients can expect when you refer them to the hotline moving forward. So I'll start by talking a little bit about the work that we do here in the Maternal and Child Health Bureau and how the hotline fits into our mission. We have a mission of promoting the health and well-being of America's mothers, children, and families. And the hotline aligns with that mission, and also supports the underlying principle that there is no health without mental health. Our strategic plan in the Bureau has 4 key goals. Those are listed on the slide here: access, equity, capacity, and impact. And the hotline really interfaces with each of those goals. If you think about, for example, access, the hotline makes sure that 24 hours a day, 7 days a week, there is emotional support, a connection with resources and referrals available to anyone across the country or their loved ones who may reach out to the hotline. From an equity standpoint, we're extending care to communities that may not otherwise have access to it. We also think about culturally and linguistically appropriate care as part of this. Our counselors at the hotline can answer phone and text in both English and Spanish. We also have 60 additional languages available for services, as well as relay service for people who are deaf or hard of hearing. From a capacity standpoint, we've been working hard to support our partners at PSI in building the capacity of the hotline workforce. For example, ongoing training to make sure that callers are receiving high quality, culturally and linguistically responsive services, making sure that the counselors have specialized training or certification in perinatal mental health. And then finally, around impact, we'll talk just in a moment about the impact the hotline has made over its first year in existence. But I also want to note that the Congress has appropriated additional resources for us to be able to support this work moving forward so that we can have even more impact in the years to come. So why are we doing this? We know that maternal mental health conditions are common, and they are among the most common conditions and complications of pregnancy and childbirth. Our partners in the states who do maternal mortality review committees, when you look across states, we know from their work, their vital work, that mental health conditions are among the leading underlying causes of pregnancy-related deaths, and those include suicides, drug overdoses, and other unintentional injuries. If left untreated, mental health conditions in the postpartum period are associated with poorer maternal and infant bonding, decreased breastfeeding initiation, and delayed infant development. Data from our colleagues at CDC shows that the rate of depression diagnoses at delivery is increasing. Approximately 1 out of every 8 women with a recent live birth reported depressive symptoms during the postpartum period. What's interesting, though, if we look broadly at statistics, is that only 1 in 8 women were not asked about symptoms of depression during a postpartum visit. And so we know there's a gap. There is the opportunity to provide resources, and the hotline is stepping in to do just that. So let's talk about this first year. We've got a year under our belt. What does that look like? So in the first 12 months of service, the counselors at the hotline have responded to over 13,000 calls and texts that are coming in from pregnant and postpartum people, as well as their loved ones. We partner with Postpartum Support International, or PSI, to operate the hotline and track the usage. PSI, in turn, provides monthly data reports to us at HRSA, including analysis and findings of key performance indicators, utilization, and continuous quality improvement. With HRSA's oversight, PSI uses these monthly data to manage, monitor, and enhance hotline services, operations, technology, and financial management. Just a few of the key performance indicators they look at are wait times and call and text volume. The hotline also collects basic de-identified demographics of users that is optional, such as age, race and ethnicity, gender identity, state and zip code, pregnancy or postpartum status, and ancillary needs related to social determinants of maternal mental health, like transportation or housing. Demographic data are collected by 2 methods, both of which are optional for callers to disclose. That can happen during the contact when counselors ask for information about the caller that might be helpful for the interaction that they're engaging with, or to assist with referrals. Or 2, callers can have the option to complete a post-conversation survey. Response rates for demographic and satisfaction data are not representative of total call volume at this time, but we're using quality improvement strategies to improve the response rates over time. Lastly, HRSA only receives de-identified aggregated data for understanding the metrics of the services delivery and monthly data reports. In our first 12 months, as I said, we've responded to over 13,000 incoming contacts. And just to give you a sense of what those are like, about 70% of those came in by phone, about 30% by text. And as you can see in the last bullet here, these responses are happening very quickly. The average response time for both telephone calls and text is well under half a minute. When we think about who's calling the hotline, most callers or texters, about 76%, are calling for themselves. About 5% are calling for someone else, such as a family member or friend. Another 5% said they were providers contacting on behalf of a client. And if you look at this blue section that's broken out, among those folks who said they were calling for themselves, we've got additional data from about half of them. More of them are reaching out in the postpartum period versus those who are pregnant. When we explore that data a bit further to understand why people are calling, the top 5 reasons people contact the hotline are depression, anxiety, feeling overwhelmed, or issues related to pregnancy and relationship conflict. It's important to note that these numbers don't add up to 100% because some people call the hotline for more than one reason. So I hope that what you hear today leaves you inspired to learn more about the hotline, to spread the word to all those in your network, especially with anybody who is pregnant or in the postpartum period. You can visit our hotline website. We've got a QR code that you can scan here, learn some basic information about the hotline. But you can also download promotional materials. We've got posters, flyers, wallet cards. We've got language that you can insert into social media or into newsletters. And you can also order limited quantities of promotional materials to be able to share with patients in person as you interact with them. I want to thank you for your time. I want to thank you all for the work that you do every day on behalf of mothers and children in this country. And now I'll turn it back over to Dante, who will introduce our next speaker. Thank you.
Thank you so much, Dr. Warren, for all of that pertinent information. And certainly we appreciate the work that you are also doing. At this time, I'd like to transition over to Ms. Tiffany J. Williams, who will take us further. Tiffany J. Williams serves as the project director for the National Maternal Mental Health Hotline. Thank you, Tiffany.
Thank you, Dr. Warren, for sharing insights of 11 months of service and supports across the National Maternal Mental Health Hotline. And thank you all for being here today. I am grateful for the opportunity to share this amazing service and resource with you all for the support afforded to our pregnant and postpartum persons, their loved ones, families, and supports. The National Maternal Mental Health Hotline is a 24/7, 365-day a year, free, confidential service that provides direct connections to qualified and professional counselors that are licensed and certified in supporting pregnant and postpartum individuals facing mental health challenges. These services of emotional support, resources, and referrals are provided in English, Spanish, and 60 on-demand languages via voice and text. I just want to walk us through a timeline really quickly. Congress authorized the first ever National Maternal Mental Health Hotline in the Consolidated Appropriations Act of 2021. The hotline subsequently piloted in April 2022 as an opportunity to test the system and its functionality, specifically with HRSA grantees and programs. HRSA officially launched the National Maternal Mental Health Hotline on May 8th, 2022 on Mother's Day. And I am delighted to be speaking to you on the heels of our first anniversary. And as uplifted by Dr. Warren, we have acquired much learning and insight from this past year of service and are intentional about the implementation of best practices to strengthen the continued availability of sound, operationally available and accessible services for our help seekers 24 hours a day, 7 days a week, and 365 days a year. The National Maternal Mental Health Hotline is staffed by licensed mental health clinicians, licensed healthcare professionals, certified peer specialists, and childbirth professionals such as doulas, lactation consultants, and childbirth educators, who are all trained and specialized in perinatal mental health practices for the support of the hotline service level demands and needs. Our counselors provide immediate psychosocial support, evidence-based information, brief intervention, and resources and referrals for treatment and recovery support services to pregnant and postpartum persons and their loved ones and supports. The counselor's scope is centered around trust building and trauma-informed care. Immediately within the interaction, our counselors build and develop rapport by actively and attentively listening to help seekers to identify their needs and purpose of the contact. The team will deploy the usage of assessment for safety as needed and when applicable, and provide resources and referrals that individuals can get the help they need when they need it. Within the interaction, our counselors use a culmination of a script and sound judgment to reaffirm confidentiality, successfully triage, and make the necessary warm transfers to our various partners. What is to be expected when contacting the National Maternal Mental Health Hotline? At the core, that is culturally and linguistically appropriate services in alignment with the national standards for culturally and linguistically appropriate services, the class in health and healthcare. The National Maternal Mental Health Hotline recognizes the importance of being purveyors of health equity, and we are committed to providing culturally responsive and intentional services. Our counselors reflect the diversity of America with considerations in regards to race, ethnicity, age, gender identity, and geography. The counselors are licensed and certified and are trained in the best practices for providing culturally and linguistically appropriate and trauma-informed support. When providing referrals to support groups and community-based providers offering in-person or telehealth services, counselors will take into account the caller or texter's preference for age, gender, race, ethnicity, language-specific resources, and insurance whenever possible. Additionally, through the capture of the social determinants of health within the interaction, our team can provide local, state, regional, and national referrals and resources to various entities for transportation, housing, food insecurity, and childcare. Within the hotline, we utilize our online directory of providers that are all vetted within the local or telehealth area. And we also have an internal resource guide to capture all of our various local, state, and national resources. Another thing that our team does is the warm transfer process. We currently host a MOU with the 988 Suicide and Crisis Lifeline, Disaster Distress Hotline, and National Domestic Violence Hotline for a warm transfer process. On these shifts that exist across the hotline, we intentionally provide having live Spanish-speaking counselors available every shift. Additionally, through our diverse recruitment of team members, we have been fortunate to additionally acquire counselors who reflect, again, the diversity of America, possessing additional language offerings and lived experiences. Using a modern translation platform, the National Maternal Mental Health Hotline serves speakers of 60 additional languages, including but not limited to Mandarin, French, German, Italian, Polish, Portuguese, Vietnamese, Hebrew, Creole, and Arabic. This allows the hotline to connect help seekers to a live, qualified interpreter in a matter of seconds. 3 things you can do to help. The overarching objective of the Hotline Strategic Marketing Plan is to market the National Maternal Mental Health Hotline services to pregnant and postpartum people experiencing mental health conditions and their support network. This is why connectedness to help seekers are critical. We want to ensure help seekers are informed about the hotline services for use whenever possible. So you can connect your patients by sharing the number 1-833-TLC-MAMA and educate and inform patients and clients of the hotline services. To date, our team has also generated products and assets for the National Maternal Mental Health Hotline. This is inclusive of our logo, newsletter content, website content, posters, social media shareables, wallet cards, flyers, magnets, a partner toolkit, and a partner presentation deck. All of this can be found on our website. Lastly, we always encourage you to share this resource on social media and within your social marketing channels. Like, share, and retweet our posts on the @HRSA.gov account, utilizing the hashtags National Maternal Mental Health Hotline, and also following all of those accounts on Twitter, Facebook, LinkedIn, and Instagram. I just want to provide some contact information for you all today. You are able to contact us directly at hotline@postpartum.net, and you may also find information about the hotline on the MCHB-HRSA.gov website under National Maternal Mental Health Hotline. Again, we're on 4 social media platforms, and we continue to encourage you to follow along and share your content on these various platforms, inclusive of Twitter, Facebook, LinkedIn, and Instagram, to stay up to date. Again, the account handles for those are @HRSA.gov or Health Resource or Services Administration. Thank you.
Thank you, Tiffany, for that information. As we prepare to wrap up today's webinar, we'd like to take a moment to thank each of you for being here today and for the important work that each of you are doing in your respective communities and organizations. For more information on the National Maternal Mental Health Hotline, be sure to visit our website. There, you will find our new toolkit and other pertinent information to assist you in this work. Thank you so much again for joining, and have an amazing day.